Now I want to talk a bit about health care. Since the Affordable Care Act was passed in 2010, there have been efforts to undermine it. But millions of Americans and thousands of Virginians have access to health care because of that law. Since the beginning of this administration, we have worked tirelessly to expand access to quality and affordable health care for Virginians. That is especially critical now during this pandemic, when access to care is so vital. One of my top priorities, even before I took office, was to expand Medicaid eligibility, and we did just that. Since we expanded Medicaid access at the start of 2019, more than 421,000 Virginians. I want to repeat that. 421,000 Virginians have enrolled in coverage, and they now have access to health care that they didn't have before that. And it is clear that there was a great need. Medicaid expansion has allowed these individuals and families to access critical services to treat medical conditions. That includes the underlying conditions that contribute to making COVID-19 so fatal. Since Virginia expanded Medicaid, more than 60,000 people have received treatment for high blood pressure. More than 33,000 were treated for diabetes, 14,000 for asthma, and nearly 10,000 treated for COPD, chronic obstructive pulmonary disease. Access to affordable health treatment is more important than ever during the COVID-19 pandemic, which is amplifying economic, health, and social disparities. We should all be grateful for this expanded coverage so that in this pandemic, those thousands of Virginians have access to the care that can keep them healthy. In fact, since we declared a state of emergency for Virginia in March of this year, almost 30,000 adult Virginians have enrolled in Medicaid through the expansion, and an additional 23,000 children have been enrolled in Medicaid. I am glad that they have access to care, but I know we need to keep working to ensure all Virginians have that access. That's why I'm convening a new work group to continue identifying ways we can reduce cost and improve the quality of health care coverage for all Virginians, regardless of how they get health insurance. This group will build off the work of the Market Stability Work Group I established last year. That group made recommendations that we worked on this past session, including creation of a state-based health insurance exchange and establishing a reinsurance program in Virginia. Both are proven strategies to reduce your premiums. Additionally, I wanted to commend the General Assembly for working with our administration to ban balance billing in the Commonwealth. Now, balance billing is when you see a provider who may not be in your insurance network and you get a bill that is a lot higher than you expected. That has been stopped in Virginia. The pandemic highlights just how important it is for every Virginian to have access to care. Accordingly, I have vetoed 3 bills, Senate Bills 235 and 861, and House Bill 735. Those bills would address health insurance cost concerns for targeted segments of the population, but in doing so would increase the cost of insurance for sicker Virginians in the marketplace. I appreciate the work of proponents of these bills and hope they will engage with the new work group to find more broad-based health care solutions for all Virginians. Our